We are live now. You may like to put off the green screen because your face is not clearly visible. can start, sir.
Good evening all. The Society of Indian Physiotherapists is proud to host a series of webinars. The objective of these webinars are to impart knowledge and skills to the physiotherapists across the country. So in a series of webinars for the last 9 months or so, we had various experts to come and share their knowledge through this webinar platform. So today we have an interesting session by our own Dr. Aarti Prasad, madam from Bangalore. She is going to enlighten us about the versatile, simple, and inspiring exercises using CLX. Madam is a clinical physiotherapist with more than 35 years of practice as a clinical therapist. She has a special interest in joint replacement rehabilitation, sacroiliac joint mobilization, and various musculoskeletal disorders. She's one of the few certified TheraBand Academy qualification from Germany across the globe. She's a trainer for taping techniques also. She has conducted various workshops, both nationally as well as internationally. She was awarded the Best Physiotherapist Award by the Rotary Club of Bangalore. She's also a speaker at national and international conferences. As a busy clinician, apart from giving her expertise to the patients, those who are in need, she's also interested in research and sharing her expertise with the younger generation of physiotherapists. In this session, Madam will be demonstrating some of the simple exercises by using the CLX. So she will also perform some live demos. Madam, over to you, Madam.
Hi, everyone. Thank you, Narasimhan. Thank you. Very, very sweet of you to introduce. And it's indeed a pleasure to be always with our own SIP people. It's our own community, and we are very happy. Most importantly, I have been practicing TheraBand for a long time. And then we started off with something that is called as CLX. So I would really would be very interested in showing you what is the kind of exercises that I do with my clients with the CLX. So shall we all go ahead? We'll start off the program. And once again, thank you so much for those kind words, Narasimhan. Praveen, first slide. I have to show you all this because I'm the approved speaker. So this is from Performance Health Academy, where I trained for the TheraBand Academy. And for the CLX, we got trained in Germany. And after that, I have been practicing it, and I'm an ardent follower of CLX. So let's start off now. I'm sure all of you all have used the TheraBand in your clinics for a long time, for so many years, because it's one of the most popular resistance way of exercising for the patients. What do you understand by CLX? CLX is basically, the full form is a consecutive loop exercise. As we go further ahead, we'll just try to understand what are the different programs that we can do with the CLX. So today we are just going to see what is CLX featuring all about. It is one of the easy techniques that we have, and it can be used for stability, mobility, and movement. So I'm going to demonstrate some exercises for all of y'all in order to understand how we can improve the stability of a joint, mobility, give mobility to the joint, and look at the muscle work more importantly. All of us, we really need to understand why TheraBand, because TheraBand is very easy. The most important why I put this slide here is I want people to understand bands are equivalent to tubing is equivalent to CLX. What do I mean by that? All of y'all must have seen or must have used TheraBand. What is the difference between the TheraBand and a CLX? I just show you one CLX to all of y'all so that you understand how it is. Now this is a CLX. This is exactly the same as a TheraBand. The difference between this is it has got loops here. So it is very easy to handle, and because of these loops that are there, it is called as the CLX. So the most important factor with the CLX is that you don't need handles to attach it. Whenever I've done a program with the TheraBand, I have always asked them, how do you attach them? Where do you attach them? How do you tell the patients to go home? How do you tell the clients to go home and do the exercises? So invariably, what I have seen is they put it on the lamp, they put it on the bedpost, or they put it on the windowsill, and then they try to do exercises. What is the advantage of a CLX is you do not need those loops. You do not need those handles. You don't have to tie it into knots. And the grip with this is fantastic. You can see I'm gripping it very well, and all of you all can see you can grip this CLX very well. So this is the most important that has really attracted me to the CLX, especially in the case of leg exercises or in the case of your waist exercises. It comes in extremely handy. Now, I just want to quickly go with the physics of the elastic band that we use as resistance. Now, the most important factors you can see in this slide, you can see the force that comes out of the band is dependent on three factors. The three important factors are the cross section, the thickness, the amount of material that goes into the TheraBand, and the other important is the elastic modulus. That means that's the coefficient of that resistance. It depends on each different band. There's a different coefficient. Now, again, the amount of material changes according to the color of the band. All of us are aware of that as the color changes, the amount of material that goes into the elastic band is different. So that can also change. Now, the important factor where a therapist can play a role is changing the length of the band. So the force that comes out of the band is exactly multiplied by the coefficient into the cross-sectional area into the change of the length. Now, where can we play a role? The most important role that we can play as therapists is in changing the length of the band. So how are we going to play with this is what we are really going to look at. So when we talk about TheraBand, we always remember the TheraBand, the resistance band, which is a product of the band, has so many colors. It goes from the yellow, red, green, blue, black, silver, and gold. These are the kind of bands that are available, and they have done a lot of research on the bands, and they have seen the amount of resistance that comes out of the band when you do 100% stretch. For example, with the red band, the kind of resistance or the kind of force that comes out to resist the muscle is 1.7 kgs. That means you can quantify the amount of resistance that is offered by the band to the muscle. So everything has been worked out, and there is a scientific way of working it out, and they have done it. And they have found that the kind of resistance offered at 100% stretch of the band varies from band to band. Okay, so we really can, when we stretch the band 100%, remember the red gives out 1.7, the green gives out 2.1 kgs of resistance that is offered to the muscle. Okay, so next slide, please. So we really work with the next slide. So we really have to understand the resistance and the torque. I'm just going to quickly go through a short amount of, say, maybe about 5 or 10 minutes of how do we understand this process more importantly. So we have to remember, can I have the previous slide, please? Can I have the previous slide, please? Now we just have to remember one thing, the torque that comes out, that is equivalent to the strength that is available in the muscle. The torque that comes out is force into distance. Remember this, and then we go ahead with the next slide, please, so that we understand. So we all have to remember, physiologically, the muscle is weakest at its end range and it's strongest at its mid-range. Now, as I remember, whenever we've done the physiology of the muscle by putting in giving a stimulus to the muscle, we have seen that the curve that comes out of it is a bell-shaped curve. So this bell-shaped curve is because the muscle is weak at the two ends and it's strongest at its mid-range. So whenever we offer a resistance to the muscle, it has to mimic the physiology of the muscle. So understand, one thing we have to understand is that whenever we stretch the band, so we are stretching the band to 100%, the amount of the red band gives out 1.7 kgs. As we keep stretching the band, the resistance offered to the muscle by the band keeps increasing. So that means the force increases in a linear fashion, but we still want the amount of resistance offered by the band to the muscle should be bell-shaped. That means at the end of the movement, the resistance offered should be minimal. How is it that going to happen is what we are really going to look at. And that is why I enjoy working with the band more importantly. Now, this is something that all of us really need to understand. So I'm just going to demonstrate it to you all. So whenever we are holding the band, and we are looking at the way the band is working, we have to understand, I hold it there for some time. I have put the band below on my leg there, and I hold it there, and I just lift it up like that, and I keep it like that for some time, say for about 20 seconds. And I can feel the strain of the muscle as it starts protesting. So you feel the fatigue in the muscle, and slowly I raise it up, and as I raise it up, one moment please. As I raise it up, you will notice that at the end range, my angle is 0. Now, what do I mean by force angle? We are looking at force angle now. The force angle is the angle that is there between the lever arm and between the force, the resistance that is offered. So it is between the band and the lever arm, that is the arm that is moving. This is called as the force angle. Okay. So if you notice, this force angle reduces because the angle reduces as the joint movement increases. So as the joint angle increases, the force angle reduces. Understand this part because that is what we are really going to work with the TheraBand. So what does the force angle has got to do with this? Now, torque is equal to the force into the lever arm into the sine of the force angle. Now, force angle, when it becomes 0, the sign of 0 becomes 0. So the torque, which is what the resistance offered to the muscle, becomes 0. So the torque that comes out of the muscle becomes 0. So people have to understand that whenever you're treating with the help of the band, your end range always should be 0. Then are you mimicking the normal physiology of the muscle? So please do not do the mistake of keeping it any way you want, and the torque at the force angle at the end should always be maintained at 0. So depends on how you act on this. This is very, very important. Your force angle, if it is 0, then the TheraBand is mimicking the physiology of the. So I hope everybody got that. The torque is the force into the distance, and so the torque is force into the lever arm into the sine of the force angle. And if the force angle is 0, that means the torque that comes out of the muscle is 0. So on this most important, so even if the resistance that is given by the resistance band is linear, it reduces by the time it goes to the end of the movement. So this is one of the most important principles on which the TheraBand works. Now, the TheraBand the resistance can be used the way we wanted. Next slide. So you can use any scale, which is, now today's most important topic is why CLX. We have to understand one thing, that CLX makes the whole exercise much easier than what we use with the TheraBand. And I'm a big, big fan of it. Next slide. We have to understand one thing, that the CLX, with the loops, we can connect very easily. So I am going to show you some exercises, but just let us go through this and we have to understand. So I will show you this exercise now so you can really understand how easy it becomes. So I'm just going to put it on my, can you help me? Just focus the camera to my legs, please. So you can just put it on your ankle, on your foot, and you can just ask the patient to do this. Or you want to do external rotation, you can do the external rotation in a sitting position if the patient is not able to stand. So remember, it is extremely easy to connect, more importantly. So the advantage of CLX is that you can connect very easily. You can, the other most important thing is you can really connect the upper and the lower chains. So you initially do always the band. See, the most important thing with the band is we have to understand one thing, that muscle always needs a challenge. So if you think you just send the clients just by teaching uni-axial movements, you are not progressing the exercise. And progressing the exercise or challenging the exercise is one of the most important duty of the physiotherapist towards the client, because the muscle will not go further, or it will not integrate itself into a movement completely. So we just don't treat only the muscle. As we all know, we really like to treat the movement. So the most important is integrating the upper chain, the lower chain, the posterior, the anterior, all of the whole body chains together to finally treat the client in a better way by giving them their movement, more importantly. So CLX makes it extremely easy to connect. Now I just show you this exercise that we have showing it there. So so all of y'all can see this, and my hand is, just push it up slightly, push it up. And my hand is going, I can turn, my hand is there. I don't have to think about any connections anywhere. And I want to bring it lower, I can bring it lower. And I want to take it into the other hand, I just take it into my other hand. It is so easy to do this exercise. So you can connect into every chain possible. Next. So next. Yeah, so it is easy to create resistance vectors. This is one of the exercises which I do for a lot of my shoulder patients. Absolutely, shoulder patients. I really do it a lot. And I just ask them to do this. And I step forward, back, step forward, back. And I can loop it through this. Most importantly, I can absolutely loop it through. It's very, very easy. See this? I can just go. See, other important factor about CLX is, remember, it has the same qualities as the band. The same principles it can work on. Simultaneously, we have all the colors that are available in the market. So I have a few examples. As we go further, I will demonstrate with the different colors. This is another exercise which I love doing. You really don't have to struggle too much to tie the band around you. You just have to loop it across, which I'll just show it to you all, how to loop it across. It is so easy. You can just loop it across, go like this, and put the band inside this. I can just put it here, and I can do rotation. And it offers a good amount of internal rotation. I don't even have to do anything. You just have to loop in. Now, if you put it from the opposite direction, it gives resistance to the external rotators. So it all depends on how you handle the CLX band. Next slide, please. CLX band, more importantly. Now, this is another one which I really enjoy working a lot with. This is called as the spiral transverse plane. So you can, again, remember, it also includes, if you look at it, it also includes a lot of transverse plane movement. So you can cut across the chains also as you're doing this exercise. So it's one of the important ones that I've really, really enjoyed working with. You don't have to loop it across. You can just put it across like this, and then you can rotations you can do. So these are the different ways by which you can really use the CLX band, more importantly. I don't know how many of you all use the TheraBand for the cervical spine. It's been one of my favorite exercises for all my clients, that once your pain reduces and everything, you can teach the patients how to use a TheraBand, because the TheraBand, remember, it offers a constant amount of resistance. So it's not like your hand pressure, which can vary from person to person. So this is one of my favorite exercises, which I teach most of my clients. I just show it to you. I would really, really love to do it with a red TheraBand. That is a warning that I'm giving all of you all. Please do not use a green one for your cervical spine patients whenever they are there, because it always can really cause a lot of pain. So you hold it like this and you just pull. Just pull. And what I like about this is, and you can do the same thing posteriorly, the same exercise can be served posteriorly. Remember, when you do this exercise, when you are coming back, you have an eccentric action of the muscle that is going on. So please do it extremely slowly. Do not give too much of jerks while you're doing this. Let it be very slow when you're coming back. What I love about this exercise is that you can just cross it. You can just cross it and you can do a lot of rotations, resisted exercises of the rotators. So you can do, and if you do it like this, it becomes exercise for the rotators. So this is very easy to hold and you can use it. Always remember, when you're returning, there is an eccentric contraction that is happening. So it has to be at a very, very slow pace. Next. So this is a vector resistance which can be done extremely easy. You just don't have to it is very easy to loop through, so you can do it. This, you generally use it whenever you want to improve your lower fibers of trapezius, so that you use it for shoulder dyskinesia more importantly. The next slide. Now, when we talk about dynamic stabilization, for what would you really use it? Now, this is where I switch the bands. Remember, dynamic stabilization, you can use it for the shoulder also. So you can ask the person to go into a crawl position. So I will just show it to you on the screen that is available there. Dynamic stabilization exercises for the shoulder. You can use it for that. Or even when you're doing shoulder exercises and you want a lot of stabilization, you can just keep one and just move the other one. What is the difference in this exercises? As you are doing this, there is a lot of contraction of the muscles of the opposite side. Especially when you do a lot of standing exercises with this, you will really realize that this can be used for stabilizing your whole pelvis into one place. When you're doing that, the same thing can be, the same exercise can be got into for your shoulders, and when you ask the patient to go into a crawling position. So I'm going to show you both these exercises, which can be used as stabilizing exercises for the shoulder stabilizers and for your pelvic stabilizers. That's what we are really going to look at. So what I'm going to do is, I'm going to do this. I'm going to hold it up there, and then it is going to go up and up. They can see, Praveen, up and up and up. Remember, your scapula is stabilizing completely before it elevates completely. This is the most important exercise that I have really seen. More importantly, this can be really done. So it goes down again. And now, what I'm just going to show you on a chair, and you can do this in a crawl position, so you can really stabilize your shoulders even further. So I'm just going to show you on a crawl position. This, imagine I'm crawling and I just pull both my scapula together and try to raise the hand. Up, 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 up. The way I have done the crawl on the wall, this is called as a shoulder crawl on the wall. I'm going to do the crawl in this position, in a crawling position. So this is a shoulder crawl, and you can do that very easily with the scapula. Remember, when you start the exercise, you always have to use the lower resistance bands. And once the client starts improving, then you can go into the higher resistance band. So I'm going to use it, show it to y'all for the lower limb. So I'm going to change the color of the band. If I want to use it for the lower limb, then I would go either for the black or the silver. Now, as I said, I'll just show you all the colors once, and then I'll start with the exercises for the. So these are the various colors that are available, that is in CLX. So you have the black, the green, the silver, and the gold. Now the gold can be used for athletes and for a lot of the people who regularly visit the gym. They can really use it. The silver also can be used for that if you really want to push the muscle more importantly. Now, for our clients in the clinic, I generally would recommend the black one. And that's what I'm going to show, one of my favorite exercises that I really work with a lot of people who have problems with their knee joints, with their hip joints. I'll just show it to you. So what I'm really going to do is I'm going to put it on to my ankle now. See that too. Yeah. So, just a minute. Yes. No? Yeah. Okay. So what we are going to do is, now we're just going to take the leg to the side. And this is going to be for all your hip, for all your knee cases. And remember, as I'm doing this, initially you can just ask the client to just take it and bring it back. But as the person improves, you can really ask them to do it with one leg standing. And when they're doing with a one leg standing, this hip automatically kicks in. So there is going to be a reaction of the adductors here, and then the abductors and the adductors here. So there is going to be a lot of stabilization of the pelvis. Now remember, as we take it even forward, I teach them even this, as I take it forward. When I take it forward, there is going to be a lot of action of the flexors and the extensors of the opposite leg. So there is going to be a lot of stabilization. So it is used to a great extent to stabilize the pelvis, stabilize the shoulders. So stability is one of the plus points for you to use it with the CLX to be used. The other important one that I really teach all of them is this, a knee flexion. If you think the person is not able stabilizing the pelvis properly, I would suggest that please ask them to take a support. So that will be really ideal for them. So just bend both sides and you can see how easily I fixed it. Remember that. You can do even flexors. Now this is one of the ideal situation for a person who has any knee pain or any hip pain. I'm also going to show you some exercises now on the floor. So we just adjust the camera slightly. So just give us 2 minutes. So we can go into a crawl position and you can ask them to do extension. Now you can see how easy it is to do hip extension. Not only hip extension, you can also ask them to do any kicks, side kicks that you would like to do. So your gluteal muscles can be really strengthened a lot as you go up, up, up. And since your hands are free, you can really ask them to stabilize the spine a lot. Now, these are some of the programs that I follow in my clinic, where I teach them how to do exercises for their, so we can do this. So you have your abductors working, but you want to have your glutes medius working, and then you can ask them to go in circuits. Now remember, this is an advanced exercise. As I said, if you think it is difficult, then you change the color of the band. Go to the lower resistance of the band. So you can just ask them to do this. So you go on and you can do hip extension even in this position. And in this position, you can ask them to do knee bends. Now, doing quadriceps in this position becomes extremely easy. No, my legs. The legs there. So you can see how easy this whole exercise program. You can simultaneously ask them to do for both the legs. So here it is. So the CLX can really be used a lot for dynamic stabilization. I repeat my warning. See that you bring back the band very slowly, not in a hurry, as there is a chances of the band snapping when it's coming back are very high. So you should bring the band back very, very slowly. So this is another exercise. It can be used. So remember, it goes into multiple planes when you do that. So it's not only the sagittal plane for resistance, but it goes into a frontal and transverse plane. So I'll just show it to you all how to do it. It's very easy. So you just keep the band here and you put the band inside. You put it inside and rotate it around the thigh. Just rotate it around the thigh. I have not put it in. If you just put it in, you don't have to hold it at all. And you can kick, you can rotate, you can take it forward. So all the movement, the most important is rotation. You'll feel the rotation in this movement very well. So remember that this CLX band can be used for all the movements. Okay? Next slide. It can be used for improving the mobility. I'm just not showing that, but I'm just telling you that we can use it for a lot of hamstring stretches for the clients where you don't have to do anything, but just teach them eccentric contractions of the muscle. So the contract relax technique will really improve to increase the mobility. Next slide. The mobility of the. This is called as a Brugger's exercise, and it improves the phasic muscles and improves the postural muscles also. All of us know very well that some muscles in the body are they stretch very easily, and most important, some muscles do not, they are in a contracted state. So some muscles are tending towards weakness and some muscles are tending towards strong, like the tendo Achilles, all of us know, the hamstrings, we all know, they really tend to become very tight. So this is one exercise which we can do for it's called as a Brugger's exercise for the postural strain. So I use it a lot for all those computer workers who come who have a lot of anterior, turned shoulders that are inside and a neck that is popping out like that. So I'm just going to show you this exercise, and it is so easy because I still remember when we were taught TheraBand, how to do it. We were taught a particular grip, how to use it for this exercise. Now I just loop it in nicely. It is so easy for me to do. So we extend our fingers, we extend the thumb, we extend the wrist. Just a moment. Yeah. So we extend the fingers, we extend the thumb, we extend the wrist, and we supinate, and then we externally rotate, and we extend the elbows, and we extend the arm, and we retract the scapula. Remember, in this position, the wrist and the fingers are completely stretched. Now, you ask your client to hold it for 10 seconds in the same position. When you just hold it like that, you will feel a lot of tingling that is going on. Your shoulders are completely retracted and you just hold it. Now, because of the CLX, it becomes very easy to hold the band in this position and your wrist in an extended movement. So this is called as the postural strain exercise, which is called a Brugger's exercise also. So this is an exercise which you can teach for all those people who are with rounded shoulders, most importantly. Now there is something that is called as for even for the lower part of the body. So in the lower part of the body, you will attach it and you do the toe dorsiflexion first, then you do the ankle dorsiflexion, then you do an eversion, external rotation and abduction. And you maintain the abduction and external rotation with the ankle dorsiflex and everted for 10 seconds again, and you will again feel a tingling that is going down your legs. So this is a stretch of your lower extremity. This is also a Brugger's exercise that is there. So your CLX can be really used very easily. Now, what do we mean by simple? This is where we are coming to simple, versatile, and effective. So there are different ways. The techniques are so many: a vector, a stealth, chain, spiral, combo, and functional. So we have seen some of the exercises which can be used. And for the shoulder, I would really love to show you some exercises, because most often or not, what I have seen is TheraBand is extremely popular with for the shoulder exercises. So I would just like to show some exercises. So it is very easy for you. Can I have the next slide, please? So it is very easy to hold the band like this and do your external rotation, which is one of the commonest things. And then you can do oblique movement. Remember, when you do the oblique movement with the help of your shoulder, naturally there is going to be a lot of core contraction that is spontaneously occurring because you are having this stability that is going on with the arm. Now you can have combination of exercises when you're using a CLX, so you don't have to do only shoulder in this fashion and this fashion. You can do a scaption plane, repeat the scaption plane more importantly. You can do even an extension, and one of my favorite exercises is the lat squat. This is one of my favorite exercises that you can really do a lot of lat exercises. It can go till here and that becomes a lat. You can feel that. And as I showed you, even the wall climbs that we do is very, very useful for your shoulder exercises. Now coming to this, I'm going to show you a lot of exercises for patterns, combined patterns, and which can be used as a regular thing in your for your clients when you have finished mobilizing the shoulders or finish improving their back muscles. So you really want to improve even further, progress the exercise, then you can do it in this fashion. So I'll just show it to you all as we go across. really want to, can you just bring it close, right? Yeah, so it goes like this, hold it, and you can just pull it. So you are doing the whole body exercise. So this is one exercise which, and when you hold it like this, you can, this is called as a monster walk. You can do even this so that you improve further. Remember, this can also be used for your clients who visit you in the clinic. It need not be done only by the. So you have the whole core contracting spontaneously. You can see this exercise, which I have already shown it to you all. So to retract the muscles more importantly. Next slide. So you have this as the overhead press. So you can just leave it there, hold it in between your thumbs, and you can just lift it up. So I'm going to use the green one because I'm really going to stretch the band and it's going to offer some resistance to me. So I can just hold and up, and up, and up. So there you go. That's an overhead press. This is more for fitness as you go further. Now this is an exercise for your shoulder. And Linton was a person who demonstrated and was happy and researched on this exercise. This is an external rotation. So you really go into a crawl position. You hold it up like that, go into a crawl position, and then you do an external rotation. I have always noticed that people, clients, when they keep coming to you for some time, I have noticed that they do get bored of the exercise. Now remember, CLX is, you can play with the CLX the way you want, and you can keep changing the exercise. So exercises become more interesting as you keep changing the exercise. So you can just put them into a crawl position and teach them to do external rotation. Latissimus, as I said, you can hold the band like this, and then you can ask them to pull it down. You change the exercise slightly, improve the stability of the scapula. You can teach them the crawl exercise. You can teach them the floor crawl exercise. And that also gives a lot of versatility to the exercises when you're looking at the clients. So this is a spiral technique. So this just goes in. And as I've already shown it to you all, you can just loop it in like this. You can hold it there and then just hold it, and you can rotate the arm. So this is another for the rotators. So it depends on which direction you hold the band, and according to that, you can give resistance to either the external rotation or the internal rotation. So this is called as the spiral technique. Now this is another exercise that you can teach for your internal and external obliques. So you can just ask the person to hold the band and turn, 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 and turn. So you do not have to ask your clients to do the same exercise. You can change the resistance of the band by changing the color of the band. For this exercise, the black will really offer a little more resistance. The silver will offer even more resistance. So it all depends on the kind of progression you want for your clients, more importantly. So I showed you this walk, lateral walk, but I showed it to you, which is called as a monster walk, which I just held it up more importantly. I mean, kept the band on the floor more importantly. So this is another exercise that all the fitness people can really do a lot, and you are including your torso along with a movement that is in a you're moving with your leg, and again the hands are also going up, so you're doing a lot of combined movements. And so this is another exercise that you really get exhausted doing with the help of a CLX. Next slide, please. So this is a lateral or a forward lunge that can be done with the help of a CLX. And you can just put on the band and then you can do a lunge so that you offer resistance to this movement. And it's very easy to fit on the CLX. Next slide, please. Next slide. Yeah. So, Narasimhan, over to you.
Thank you very much, madam, for the wonderful demonstration. It was really interesting. It was really interesting and very useful to the therapists, those who are watching. There are a couple of questions from the participants in Facebook. So before taking that questions, I just have one or two questions. It's not a question, just a clarification. It's fantastic to see, such a simple tool to encourage exercises. What I see from the evidence-based practice, is there any, high-quality studies which has been conducted, which shows that these techniques are useful in your knowledge?
Oh, there are a lot of studies that have come out, and Phil Page has been my teacher. In fact, he has come out with a book on muscle imbalances. So there is a lot of research that whatever I have talked about today, there is a lot of research that it is absolutely evidence-based, even about the force angle. It's all they have done with various bands of shoulder at 90 degrees. And they have seen the evidence that the resistance increases and the torque changes completely when it goes to when the force angle reduces. So there is a lot of studies that they have come out with, and which have come out and have been published in well-known journals. And you will find a lot of articles in PubMed also. So these are, sorry.
Yeah, the next point is, in our setup, in our Indian setup, in your experience, how the adherence to these set of exercises when you prescribe, using resistive bands, what type of adherence you see in your patients, in your clients?
Yeah, Narasimhan, there is one point which I was very strongly, vehemently for is that if you teach the client just movements like this, simple uniaxial movement, there is certain amount of boredom that creeps into the exercise program after some time.
Correct.
And this has been my observation.
Yes.
So whenever you have a boredom coming in, it is like asking a client to walk every day for 5 kilometers. That's going to be your exercise. There is a certain amount of boredom. So they will not adhere to the exercise. What I have noticed is that when I give them the band exercises in the department of physiotherapy, I have noticed that by the end of the last few sessions, they will always come back and ask me, you have not asked me to buy the band. Where can I get it? So that means they would like to do the band exercises. Now, the other way to adhere to seeing that the client adheres to exercises, not only by giving them the band, but changing the exercise. I have not told you all the progression. There are a lot of progression.
Yeah.
I teach them how to do it as I said, in a crawl position to standing position. Changing posture itself changes the exercise. That is one of the most important things. I use wobble boards, I use ball, I use a lot of stability trainers. So you change the exercise so that you captivate them. You keep them in the loop, more importantly. And you also give them a chart by telling them, asking them that this is the way you're going to tick. Tick, you've done. Tick, you've done. Tick, you've done. And there are a lot of patients, they say, we feel very happy doing it and we don't mind ticking it. Maybe the older generation will adhere to the exercise much more than the younger generation because they would like to.
So it makes the boredom, it increases.
Yes.
Anyway. So there are some question from the Facebook chat. Ms. Ritu Shani, she wants to know, is upper chain exercises with band good for frozen shoulder patient for their range of motion improvement?
Now, when I want to improve range of motion for the shoulder, I would use a different technique. I would make them lie down and I would hold the band. I would ice the part first and I would hold the band into 15 seconds into the range that I really want to improve. I hold it there for some time and then release it again. Again, ice it, again increase the range and hold it with the help of a band. That is what I would really more importantly do. But if I really want to do an exercise with the help of upper chain, I would use a CLX more importantly. And as I said, I'm going to be in a standing position or in a crawl position, or I would be against the wall. And I would do a lot of exercise like this. You can play with the CLX, as I said, you don't have to follow this single exercise. Now, with the CLX, when you're doing upper chain or you're doing, you always do a combination of movement. Remember, do not do an uniaxial movement. That is not going to help. For me, a combination improves because my core also gets activated more importantly. So I would really do an exercise which combines my whole spiral movement. But if you want to improve the range of motion, the only way with the band that you can use it is you can hold it down for 15 seconds, release, hold it down and release. That is the way. But for the band to be used for mobility in a show, it's not, it's more for strength and stability. I would really use it.
Yeah, there is another question. Should we start with the black band at the beginning to improve the strength?
I asked the question back. For which part do you want to use the black band? It depends on that.
Yeah, she asks for shoulder.
For the shoulder, it's a no-no, absolute no-no, because you're really going to damage the joint. It becomes extremely painful, it becomes raw, it becomes sore. So I would really start with the yellow band because I'm really going to strengthen the shoulder, firstly, in the range that is possible. Secondly, depending on the patient's strength of the muscle, more importantly. So I would always start with the yellow and then go on to the red and then if necessary, go on to the green. That is the way I would really progress. A black always for the lower extremity.
So that means that the protocol has to be followed, isn't it? The resistance
yes.
identification. The protocol has to be followed.
And you look at the power.
Yeah. There is another question from Ms. Aishi Bachuka. Is there any good exercise using band for patients with hypertension at knee? I cannot understand that. Hypertension at knee. I think she means tightness.
Hypertension.
I think she meant that tension, the tightness, hamstring tightness, I think.
Yeah, as I said, hamstring tightness, a tightness in the muscle can be released. Do you want to demonstrate that exercise? You want me to show the exercise, Narasimhan? Then I have to go on the floor and show it.
Yeah, if you can. Yeah, if you can, maybe one, yeah.
Okay, can I ask Praveen to be my model, if you don't mind?
Yeah, yes, madam, please.
Okay, so just give me half a minute. Praveen, just slide. I'll just move the camera and just tell me if you can see him clearly. Can you all?
Yeah, yes, we can. Yeah, yes, we can. Yeah.
Okay, so when I mentioned the hamstring tightness, I would like to do this. I would like to do it like this, keeping it down. Stretch the band and hold it. He's stretching the band and holding it now. And I'm just going to move the ankle up and down. Just move the ankle up and down. And he's going to lift it with the ankle into dorsiflexion. And keep your neck down, keep your neck down. Yeah, and he's going to hold it in it, and he's already telling me that my hamstrings are paining. I'm not done anything absolutely. So I'm just making him in that position, and I'm going to ask him to do the dorsiflexion and the plantar flexion again. And he's going to hold it in that position. Can you feel the pain? Now, I'm going to ask him to hold the ankle into dorsiflexion and bring it down slowly. So there is going to be an eccentric contraction. This is what I meant by that. So you bring it down slowly, bring it down slowly, bring it down slowly. And we repeat it 2 to 3 times. And you will definitely see the hamstrings relaxing to quite an extent. This is the way you can use it for any muscle that you really want to do. We also use it a lot for plantar fasciitis, for the tightness in the fascia that is there. We use it we do the same thing. That answers the question, Narsimhan?
Yes, madam. I think that answers her question. What precautions you would advise for the therapist before starting using these bands?
Before using the bands, okay.
Yeah.
Now, the most important is that whenever you're using the band, always start with a uniaxial movement. You're not going to do a multi-axial movement because you really have to see what is the power that is available for them to hold the band. As I said, the color of the band, using the color of the band is extremely important. So you test their muscle power and then you decide what is the color of the band that you're going to give. The posture that you give is also extremely important. See that the band does not have holes in it whenever you're starting with the band, because the band can really tear very easily. When you're holding the band, see that it does not snap back. I have seen eye injuries with bands. So it just snaps back, then so you have to be very careful. So these are some of the important care that you take before you start with the band exercises.
So you mean to say whatever the exercises, as per the protocol, the therapist needs to assess and identify, reason out, and then select the band accordingly. I think your point is very, very clear. Yeah.
As being taught by our teachers. Assessment.
Yes,
is very
the reasoning.
important.
Yeah, the reasoning point. Yeah, that's fine. Thank you very much, madam, for the wonderful session. Thank you very much for sparing your time. It is always nice to listen to you and learn from you. As a clinician, you bring the practicality into the field. We are fortunate to have you. Once again, thank you very much on behalf of Society of Indian Physiotherapists. It's being a wonderful session. We also would like to thank Dr. Nitesh Bansal, our secretary, for coordinating this and providing our the facilities and the support. We would also like to announce people to make use of this opportunity to avail our SIP grants. Society of Indian Physiotherapists is providing research grants, startup grants in various category. For this year, the grant is open. We request all the academicians, senior physiotherapists, and the postgraduate students, the practicing therapist. That's one of the thing. It's the novel here is the SIP provides grants even for the clinical therapists to encourage them to come into the research. So please avail this opportunity. Now the details are available on the website. You will be able to get the details, and the last date for application is January 15, 2021. We look forward to get many applications this year. So we also would like to thank the OrthoTV, Mr. Rahul Chobe, for coordinating this activity and then live telecasting this webinar in YouTube. So once again, thank you all. Thank you very much, madam.
Thank you. Thank you so much. It's always a pleasure to talk about CLX band or TheraBand. It's one of my favorite topics. So thank you, Nitish, for being there as one of the biggest backbones of SIP and conducting these programs regularly. And Narasimhan, as usual, you've been wonderful.
Thanks, madam. Yeah. Once again, thank you all. We will meet with the next webinar. You will get the announcement soon. Thank you all. Bye-bye. Take care.
We can switch off. Were there, huh?